Hi, Dr. Scalene here. So today we're going to do some mobility drills for the neck, the shoulders, and the upper back. So in today's modern world, where everyone is on their cell phones, and people at the office are on laptops and computers, and they tend to be leaning forward, sort of hunched over. Maybe their workstation is not ergonomic enough, and they're developing bad posture. So as a result, people will develop neck pain, shoulder pain, upper back tightness. So I'm going to show you some exercises and some stretches to deal with these three areas here. When you're about to do these mobility drills, a great idea would be to loosen the upper back muscles. A lot of people, because of an office job and they're leaning over a laptop for many hours, may develop some tightness between the shoulder blades right here. And a great idea would be to use a tennis ball to massage those muscles. Okay, it's very simple. You can find a tennis ball anywhere. So either you're on a yoga mat or some sort of surface with friction so the ball doesn't slip when you're doing this particular drill. So lie down. Okay, the tennis ball, put it between the shoulder blade and the spine, not on the spine, not on the shoulder blade. Between here, right down here. Right, put the hand to the front. So this way you sort of pull the shoulder blade out of the way, allowing the ball to get into the muscle, and roll backward and forward. Backward and forward. Really loosen up those muscles, rock side to side. Okay. The ball may actually be on a tight spot or what is called a trigger point or a knot, in layman's term. And rock side to side, up and down. Really massage those tight spots out. And move the ball up a little further. Let me get some tight spots here. If you think the ball is going to slip away from you, just put your hand right here. Keep it in position. All right, back and forth. Just for a couple minutes on one side, then you switch over the other side. Principle is the same, of course. Lay down on it. Pull the hand this way. Get the shoulder blade out of the way. Up and down, side to side. Bring it up again. Up and down, side to side. Okay, so for those of you who shop online, a substitute for the tennis ball would be peanut massager. As you can see, it's two lacrosse balls in some sort of foam material joined together. And the principle is the same, but the difference here is that you can actually do both sides at once. The spine comes right here. You don't want the ball actually rolling on the spine. So the spine comes here and the two muscles are here. So this is how you do it. Right here, now you see you're actually doing the two muscles at the same time. Bring the body up with the legs. Really rock backward and forward. Really get those tight spots out. Do the arms like this. Get the shoulder blades out of the way. Backward and forward. Backward and forward. Work your way down. Really get those tight spots out. Great. Do this for a couple minutes. So now we're going to do some neck stretches. Sit on a chair. Grab the underside of the chair here. Look forward. And now you're going to tip your head in the opposite direction. Feel a nice stretch over here. Okay. Normally hold on for 20 to 30 seconds. Ease out of it. The next hand. Anchor yourself right there. Look forward. Lean to the side. Get a nice stretch over there. Okay. 20 to 30 seconds. Great. And you can do that 3 times for each side. So now we're going to look up and look down. Sit straight. Now, start with yourself looking straight ahead. Lean backward. Come forward. Try to tuck your chin into the chest. Lean backward. Get that range of motion. Come forward. Now it is important that you don't cause yourself a lot of pain. There may be some discomfort, maybe some sensation of pulling or some tension. But if you think that the pain levels are too much as you reach a certain point, for example, if you think right here, the pain is too much, don't force yourself to go all the way back. Just stop. Where the pain, maybe they feel a bit uncomfortable. Come forward, tuck the chin into the chest. Okay? With time, you will see you will be able to increase your range of motion with less and less pain until you can finally do the full range fairly comfortable. So the next exercise is the chin tuck. Now with this exercise, you're trying to make a double chin. You're looking straight ahead. When you're drawing the head backward, you're not looking up or looking down. Looking straight ahead, but the head comes back, creating a double chin. So you're like this. Yeah. So some of you may get some trouble initially while doing this. So another trick you can do is actually start with the head a bit forward. So instead of starting at neutral, come forward first, then you go back. Forward first, all the way back. You may feel some tension behind here, okay? As time goes by and you keep doing this more and more often, it will become more comfortable. You'll find you have a greater range of motion. We've seen some clients here where the range of motion is very minimal, so they may not even be able to do this, or rather just there. Some of them, the neck is so tight, the range of motion is minimal, but with practice, they go from doing this to getting a more full range of motion like this. Okay, again, if you're getting some trouble, start forward and go back. Start forward and go back. Okay. This next exercise, you're trying to push the air towards the ceiling. So you tip to one side, but in doing this, you're not thinking about bringing the air to the shoulder, rather pushing this air towards the ceiling. So you're like this. Feel a stretch right there. Okay? Do this, and I'm trying to push this air towards the ceiling to really get a stretch here. Relax. Push the air towards the ceiling. Relax. Push that air towards the ceiling. And relax. This next exercise is to exercise the scalene muscles. With this exercise, I'm going to try to push the nose towards the ceiling. If you recall, we did an exercise where the chin was being tucked in like this. So basically what I'm going to do is something that is the quote-unquote reverse of that. For that one, I'll be lying flat. So when I'm doing this exercise, I'm thinking about touching my nose towards the ceiling. The head is going to move in this almost vertical movement, like that. Okay? So I'm here, and nose towards the ceiling, and come back down. Nose towards the ceiling, come back down. Nose towards the ceiling, come back down. For some people, this is so tight they can't even get 5 repetitions. But you really need to work at it to the point where you're getting 30 and 40 repetitions. Okay? Again, nose towards the ceiling, hold for a second, come back down. I want you to control the head as it comes down. I don't want the head to just drop. Okay? It's up, really flex those muscles, and come back down slowly. Really flex those muscles, nose towards the ceiling, and come back down. Again, work your way where you can get 30 to 40 repetitions. If you can't even get 5, that is fine. Take a break, do what you can do, and then next day you can try again. Now for a shoulder mobility exercise, something called wall angels. So stand with your back to the wall. Okay, put your head flat against the wall. Feel the shoulder blades against the wall. Bring your hands out in front of you like this. Bend, get the elbows to touch the wall. Rotate until the palms, the back of the hands touch the wall. And then you go up and come back down. Go up, come back down. Really try to keep the palms, the back of the hands touching the wall, up and back down. Okay, so for some people, they may not actually be able to get the back of the hands to touch the wall when they're moving up. So some of them start here, and as they begin to move up, the hands travel away from the wall, and they really can't keep the back of the hands against the wall. But with time and with practice, the back of the hands touch the wall, and they can keep them on the wall for the entire range of the movement. Okay? So again, don't despair if your hands don't stay on the wall as you're going through the movement. Practice it, do it on a daily basis, and you will see with time, the back of your hands will be able to stay on the wall as you move upward. Aim to do this 20 to 30 times. Okay, so now we're going to do some wall arm rotations. Stand with your back to the wall, head touching the wall, shoulder blades against the wall. Hands start at the front, elbows touch the wall. Now you're going to rotate, get the back of the hands to touch the wall, rotate downward, try to touch the wall. Up and down. Okay, some of you may have some flexibility issues where this might be the maximum point that you can reach for now, but with time you will see you'll be able to touch the wall, rotate, 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 rotate. Okay, aim to do this 20 to 30 times. So another simple exercise that you can do to improve your shoulder mobility, simple arm circles. Stand with the arm to the side and rotate up. Let's make some circles. Okay, don't swing like this, okay? Take your time, control. Nice, big, slow circles. Okay. If you're getting any pain, okay, you need to stop, get it checked out. Okay. But once you can do it, maybe some tightness, maybe some slight discomfort. Aim for 20 to 30 circles on one side, and when you're done, 20 to 30 circles on the other side. Sometimes we get so accustomed with a short range of movement that when we begin to do this, it feels strange. Some new aches and pains develop as you begin to work the muscle in a range that it is not accustomed to. That's normal. If you're a bit sore from the exercise, take a break next day. You can start on the following day. So now we want to do some exercises for the upper back. And again, if you recall, if you are doing a lot of work at an office desk, or you're sitting in this position for long periods of time, muscle between the shoulder blades here may become very tight. So it is a good idea to stretch and exercise those muscles. Very simple way to do it. Stand up, put both your hands forward, and lean forward. The upper back, I want you to arch the upper back forward and push forward, so that way it opens up the shoulder blades. So you're here, and then you push forward, punch, and you really feel a stretch between the shoulder blades. Then you pull back the shoulder blades, try to make the shoulder blades touch each other. So you're here, shoulder blades are open. Pull back, really feel the muscle between the shoulder blades contract. Lean forward again, really open up. Think about the shoulder blades opening up like that. Opening up. Pull the shoulder blades together. Reach forward, open up between the shoulder blades. Really feel that stretch in between there. Yeah, right there I'm getting some stretch. And back. Do a contraction of the muscle between the shoulder blades. Reach forward again. Open up those shoulder blades. Pull back. Squeeze the muscles between those shoulder blades. Okay, do that for 10 to 15 times. Rest about 30 seconds. Repeat it 2 more times. So now I'm going to demonstrate an exercise that exercises the upper spine or the thoracic spine. We have here at the clinic this semicircular cushion, okay, that was custom made. Now what you can do, you can probably take some sofa cushions, put one on top of each other. Maybe you might need 3 to 4 sofa cushions to create something to this effect. But what I'm going to do, I just don't want my belt to cut the leather, so I'm going to just rest the sheet over it, like that here. Good. So I'm going to position my body, but now I'm not going to put the stomach over this to arch the lower back. Rather, I'm going to more put my chest on it so the upper back is arched forward. So I'm here. Right here, notice how the upper back is arched. And in this position, I'm going to raise. I'll put my hands here. I'm going to upper back. Straighten the upper back. Straighten the upper back. This will strengthen the muscles of the upper back, also stretching them, working them through a range of motion, increasing the mobility, increasing the flexibility of the upper back. This exercise may not be for everybody. It can be uncomfortable for some people, but I'm demonstrating it for you because there are those who can benefit from this exercise. Slump back down. Really squeeze the muscles of the upper back and back down. Okay, so now I'm going to lie on my back on the semicircular cushion, stretch the upper back. Before I was on my chest, I want to lay on my back. And again, the principle here is that I want the thoracic spine, this part of the spine here, okay, to be stretched. So, to lay on my back. Right, so the upper back is here. I just relax, just let it stretch, really feeling that stretch there. Okay, so once again, if you don't have this device, you can just take some sofa cushions and put one on top of each other, maybe 3 or 4 of them, and just try to mimic this movement. Again, it's not for everybody, but I'm demonstrating it because some people really can benefit from this. Done, slide down. Good. So another exercise you can do for shoulder mobility is an external rotation of the arm like this. In this case, I'm going to use some resistance. I'm going to use a resistance band that has been anchored to the wall. Okay. You start like this. The forearm is parallel to the floor. The elbow is at a right angle. Stand to a point where you feel some tension in the band. And now you rotate outward and relax. Rotate outward and relax. Rotate outward and relax. Okay, this is not a jerky movement where you're doing that. Okay, no. Control and relax. Also, what you can do when you're done, upper arm is now parallel to the floor, elbow at right angle. And now you rotate. Try to keep the upper arm parallel to the floor through the movement. Okay. Do both movements for 10 to 15 repetitions. Take a 30-second rest and repeat. So I hope you enjoyed our presentation on how to do certain mobility drills for the neck, the shoulders, and the upper back. I advise you to give these exercises a try. However, if you're unsure about anything, if you think your pain is increasing, if something does not feel right, feel free to call us, speak to us over the phone, describe your problem. We will advise you, but keep in mind that we do offer therapy for these issues. We attend to neck pain, shoulder pain, and upper back on a regular basis. We have therapists, we have massage therapists, physiotherapists, and medical doctors who can help you.